Good morning. Today I am going to talk about the hospital acquired infection. So first we have know the source of infection. There are two types of the infection. First is that endogenous. This is called the self-infection, and there are the organs. First is skin, second is nose, third is throat, fourth is mouth, fifth is intestine, and sixth is tissues. This infected lesion, skin, nose, throat, mouth, intestine, and tissues. Second is that exogenous, the source of infection, airborne, skin, scales, droplet. This is airborne due to, and exogenous have two parts. The source of infection will come, and second is the due to contact. It come in contact. There are the two types, direct and indirect. So first direct, an organ, and they are contact, hands, clothings, equipments. In hands and clothing there are the contaminated dressing and disinfectants. And equipment, for example, like the ventilator and urinary catheter. There are the another contact, the source of infection. And in the indirect, nosocomial equipment, just like the bedpan, bowels, jug, or food. This is the indirect contact. Due to this, infection should be spread. There are high risk areas in the hospital, just like the ICU, NICU, burn units, nurseries, OTs, post-operative wards, dialysis units, organ transplant units, isolation wards, lab, and oncological ward. So this area in the hospital are much more sensitive area, and there are much more possibility to infection will come, and it should be spread. There are the hospital infection control program. So next concept is how hospital infection control program should be provided, and how it should be procedure and functioning in the hospital. So in the center, the patient, other patients, endogenous and hospital persons, air, equipments, instruments, and formalities. The infection process may be thought of as a chain with three interrelated components. First is infectious agent, means the transmission, and second is susceptible host. So it will make a chain in the hospital area, and modes of transmission is that direct contact, indirect contact, droplet, aerosols, skin squamous, common vehicles of the transportations, and droplet infection. So there are in the hospital area hospital acquired infection. This is the most important subject. Today I talk about the hospital acquired infection, and it's a very dangerous and very critical conditions because the total hospital unit will be involved gradually when the infection should be spread in the hospital area. So be aware towards the infection, and this is the duty for everyone, how every person will control, and they have the important role to control the hospital acquired infection. All the visitors, staffing pattern in the hospital who have the working doctors, administration block, paramedical, ancillary department, group D staffs, all the staffs who have working in the hospital area, and there are the some sensitive area also is responsible. There are the possibility to make infection, hospital acquired infection, and it should be spread sometime rapidly. So be aware towards your health and towards your duty when you will visit the hospital, and all the staffing patterns, even including the doctors, administration sections, they have the responsibility to control and command the whole system, and it should be prevent hospital acquired infection that is much more problematic for the people if it will happen. So be careful, be healthy. Today